our slogan is, it's about our community. And it really is. I know that all the administration focuses on what can we do, how does this affect the community, what decisions we make, how does it affect the community. We spent time this year, or actually last year, doing a strategic plan, a 5-year strategic plan of what we're going to be doing to help improve patient care, patient experience, patient quality metrics. All those kinds of things are very focused on our community. My DBA, Deb, came to me and said, I want to access eForms. And we had a previous, company. I don't know. We don't need to go over the previous company. But what it came down to was support. We saw the integrations that could happen. Being part of Meditech is, a phenomenal, integration that everyone loves. I know that Meditech themselves uses Access eForms for their forms. So that was a big, kind of like, oh, well, if this is the company that they're using for their own forms, that should speak volumes to the kind of product that they want to have and we want to have on our campus.
My role is I take care of the people that take care of my patients. The biggest problem that we had, one of the biggest problems, is that every clinic wanted their consent to be a little different. They wanted it to say something different. So then we would have to take it to the forms committee here at the hospital. They would have to approve it, and then we would have to, we would take it to the print shop. It would be printed off, and then that was just a cost. And so then you would either, if people ran out of those consents, they would just make copies of them, which was awful. It looked awful. And then you scanned it in. And
you're talking about copies of copies of
copies of copies of copies. And then it's like, and by the time you scan it in and it gets in the chart, you can't hardly even read it. And so that was one of my big things that I did not like. Before we went with Access, I didn't really even think about the cost of like the paper and then the time that patients or that our staff were using to scan in paperwork. And then we have the shredder. And then we have scanners that, they have to be fixed or maintained or whatever. And I thought, gosh, we have really cut down on a lot of cost.
So now that we've moved on to Expanse, it is a much better product. We can see what they do. If a patient goes to the emergency room, if a patient goes to specialty, that specialty wants certain labs done, we can see that order in their chart. And so what's great about the Access now is we can look to see in this patient's chart in Expanse if they have been to another facility, if they've been to a specialty facility, they've signed that consent for all clinics. We don't have to have them fill that back out again for another year. It's great. You don't have the repetitive paperwork that you would before. And so being integrated together with the specialty clinic, with the hospital, they may only have to come here and sign one e-access form compared to many as before because each place had its own forms. And so now they come here, we bring up their registration, we see that they have signed what they needed to sign, and we get them checked right in. Their insurance cards are in there, their signatures are in there, their consent to treat, their, protected health information forms are signed. So, that makes it better for the patient. That makes it less time consuming for the patient and for us as well because we don't have to scan those forms in now because they're already into our system.
We have a lot of vendors that approach us constantly about saying, hey, we have the next great product. If you take this product, it's like a magic pill. All your problems will go away. And it's one of those things that we just kind of laugh about. And so when we talk with Access, that's kind of off the table because we know we have, and we know that there's a partnership there. So if something's not working, it's very easy to get Access and Meditech at the same table to work it out. And that goes a long way for me and my team in the IT aspect to be able to know that ultimately I'm going to have a solution.
I believe that the impression you make on the person when they walk in the door is the most important. With the old vendor that we were using, we were causing a lot more work for ourselves because the forms were not syncing into the accounts and we would have to call the patient directly to get verbal consents, and I just don't see that as a good quality because we're bugging the patient after the fact. They already signed the form, then we're having to call them again, and it just wasn't working well.
With our old vendor, we would have to, patients can sign or whatever, but as far as inputting information, we'd have to print it out, fill it out, scan it in. Whereas now, the way Access is designed, we're able to fill everything and write that in there and then just save it, and it goes straight to the account, and there's no And like she said, of course, unless there's user error, it's a lot more friendly with making sure everything gets saved and put into the account. That way we don't have to call and bug patients after they've already left our facility.
It's very, the patient experience portion of it is improved a lot. It also helps the patient behind them too, because they don't have to wait so long to be registered, because there's always a line of people to be registered.
Because we're rural and we have a lot of elderly people that aren't tech savvy, I guess. You know, some of our patients are so rural, they don't have internet, you know. And so it was, I think, the first little while of trying to get them to, you know, hand them this, and but then once you gave them the stylus and just, you know, you told them where to sign, now they love it. Yes, they hate paper. They don't want to write anything, you know. They're so used to texting and, you know, using their thumbs. So it works really, really well with them. We're trying to not really compete with the big metropolitan hospitals, but we are.
I think change is good. If you don't change with the world, you'll fall behind. So before, when we had the paper charts, you would have to pull your charts for the day of your patients that were coming in. You know, you kept a schedule. Of course, it was still in the computer, but it wasn't as patient friendly as it is now. We would hand out at least 4 to 5 pages per each patient. You know, we would have to make sure every single page was there. We would have to make sure every page was signed before the patient left. You know, then we'd have to sign our name, date and time, every single page. So that was like, say if you did 5 pages, that was each new patient, or each time it was their year was up, you had to do. And so my staff love it. Patients love the iPad signatures. They see that we are changing with the times of, you know, electronic records. I think the patient experience is the best thing to do, because when you bring them in, then they experience, oh, well, they have paper, or they're not paper anymore. And you know, and they come in and they're like, oh my gosh, they are changing with the times. You know, they're not back where there was paper anymore. They don't have paper charts. So I think they feel more comfortable now when we're going to the electronic system, because, you know, we can let them know, hey, you know, when you go to the specialty clinic, they can see your records, they can see what we've done, so they feel more comfortable that they can look at it as a whole, rather than, oh, well, you know, I've got to wait for that lab work to get faxed over to them, and, you know, and they can see, you know, from beginning to end when they get here, oh, well, they've already got my lab work, and they've already got, you know, the office note from when they were at our office. You know, they've really changed from what they used to be.
My name is Satya. I'm an advanced admissions rep here at Malcolm Regional. I've been here for 4 years, and I also got to help Deb with the build for Access E for our facility. I work in our outpatient building, Building B, which we probably have a higher number of registrations in our departments. We usually see about 100 to 130 people a day.
I believe that the impression you make on the person when they walk in the door is the most important. And sometimes you feel like a robot just typing and going, and it's nice to make the patient feel like they matter.
That little delay we get from registering and finishing up to the delay that it has to get to Access E, you know, we don't have to spend that 15 seconds looking up the patient. We can interact with the patient, ask how they're doing, you know. While it's loading and pulling everything up, we have that time to interact and not just focus on our computer and not pay attention to the patient.
It's nice to be able to stop and ask how their day is going, or is there anything we can get you, or is, you know, something that's very personable.
I'm Julie Johnson, and I am the Director of Health Information Management, Patient Access, and the HIPAA Privacy Officer. And I've been here 32 years. And what else? The role of HIM Director basically is to keep the continuity of care moving for patients, for providers, to ensure that the record is complete and correct, so the record is defensible if we need to go to court for some reason, that the providers have what they need at their fingertips when they need it. But I was so excited when Justin told me about Access eForms. I said, yes, You mean we can get the person to sign right there at that time? We're not going to be losing all of these papers. We knew we had a problem with forms. We'd gotten forms together over the years, and there were just pages and pages and pages of forms, obsolete forms, new forms that were constantly, all of a sudden in medical records, we'd see, what is this? We'd have to track it down. Who was it? Where does it go? Where does it go in the record? And so finally, actually it was Deb who put everything together, and we got it all together. Versions are great. I think we're right on top of it, and it's been wonderful because adding a couple of clinics to the hospital and having to do their forms, and now we're adding another one and more forms. It's just fantastic that we have something in place that's really going to work for us.
Before Access, we used paper, paper consents, paper PHI forms, everything was paper. On the paper, we had to write 3 patient identifiers on the top of the paper. We had to timestamp everything manually. We had to fill everything out by hand, and then on top of that, we had to scan in all the documents. We had to scan everything into the accounts. So now with the eSignatures, we just have to scan a barcode. We hand them the iPad. They read through the consent forms and all the documentation. They sign off on it, and it's right there in their account. It automatically stamps the identifiers. It pretty much does everything for us. It's probably dropped registration by 5 minutes per registration, I would say. And that's made us a lot more productive in other areas.
You know, I come from the land of paper charts, paper charting. You know, other facilities can't see your papers unless you send it to them. You know, as far as it being handwritten, sometimes it was very hard to read. Then we moved to an electronic system called Allscripts. Allscripts was you know, decently user-friendly, but we were on a different type of Allscripts system as the hospital, so we didn't integrate together. They couldn't really see what was going on.
I have learned that the easier the process is, the happier the registrar is. If we can put things in place like Access that we have to make their jobs just a little bit easier, because again, they're registering at least 50 people a day. If we can put processes in place that help them make their workflow more seamless, they're excited. They're like, oh, this was a great day. I didn't have a terrible day. So it really does help their well-being and their livelihood, because it, again, anything that's easier and more seamless helps them be able to, one, focus on the patient, and their workflow is a lot easier. The difference is the compassion. Whenever you're frustrated at work and you really don't want to be here, you don't pay as much attention to the details or to the person in general. You're just kind of clicking and do you still have this? Do you still have that? And you don't really show, like, even your personality, or like, it doesn't show. And so then the patient just becomes another number. It just, I just have to get this done, and you don't really care about the patient being here and the care that they have, because we are the first line of defense. We're usually the first person that the patient interacts with at a lengthy time. And so if you are not compassionate, if you are nonchalant and just disengaged, the patient will feel that, and that will affect their entire experience.
It's been marvelous. I really like the integration with Access eForms with Meditech, that has just helped us tremendously. But the best thing about that is that when we're doing deficiencies, to see maybe there's a nurse that needs a signature that hadn't gotten it done, sometimes it'd be a month before that nurse was back on, so we had to wait. So then the provider didn't actually get that signature for him to sign off on it yet, and so that held up our medical records, that held up our deficiencies. So now, with Access eForms and signatures, the nurses can go in there and get theirs, or other providers, or CRNAs. Anybody can go in there and get the signatures. It gets to the provider right away, and it helps with our continuity of care and to get the deficiencies taken care of.
So with the eSig, once you submit, I mean, Lisa can pull a face sheet from her workstation. She's not waiting on anyone to scan it in, or we're not worrying about it getting misplaced.
So our face sheet not only contains our demographic information, it contains our consent to treat and our consent to bill insurance. So without those, we're treating a patient without consent. So that's a no-no. So this ensures that we get the right face sheet on the right patient, because the way we save things in the back end and that network of ECM and cold feeds, we're able to take what is immediately signed and basically digitize it and then bring it up in Meditech real time, but we're at a 100% guarantee, or as close to it as you can get, that the face sheet that patient John Doe signed is in patient John Doe's chart, and it never gets mixed up.
Access is very helpful because, especially when we go through things like downtime, it helps the registrars still have a flow, because it's so robust already for them to be able to come in and learn everything that they need to learn before they go out on the floor and be what we call independent. So with Access, even if we go through a downtime, it doesn't send people into a frenzy. They can still look at the forms that they have, and they look exactly the same as they do if they were in Meditech. So they still have the flow of, oh, I can ask the patient these questions. I don't have to come up with them off the top of my head and try to remember what's in Meditech to get the appropriate answers from the patient. So that's why it's important for me, because it creates that seamless flow for our registrars, especially because I spend so much time teaching and reteaching them and making sure that they're comfortable and making sure that they're giving the patients the access that they need in a way that it's not painful for the patient, because we all know in healthcare, we're a hospital system, they're coming in for something already, and it's a pain to have to deal with something that they probably repeat multiple times a day, right? So I think Access does help with that. It makes the process so seamless. And then even for the registrar, when the system does come back up, it helps them to put that information back in Meditech without it being a hassle for them or feeling like they're doing like triple work, because those processes are already there for them.
My name is Justin Millar. I am the Information Technology Director and Security Management, and I have been here 2 years this month. We discovered in the process of regimenting our forms, essentially, like making them consistent, that we had things that were out of order. We had signatures that were, not captured in the right timeline, per se. And Access eForms makes us do that in the right timeline, which is so much better for medical records and those kinds of things. And yes, it was an adjustment the first week or two, but I think our first month we had over 4,000, 5,000 forms. It was in the thousands of signatures and captured that were all done seamlessly without, you know what I mean? Like, you think about how many, if you went into HIM department beforehand and you would see stacks of papers that needed to be scanned. And now when you go in there, there's nothing.
Being in a rural setting like this, we don't have like 5 or 6 people to check patients in. That's what we used to do, because most of the time you would have 2 or 3 people standing in your line getting ready to be checked in. And so you would just have a clipboard and you would have the consent, like the notice of privacy practices, and then you'd have to have your HPI or, and so they would go sit down and fill it out, and we would hear them grumble. It's like, I just filled this out, why am I filling this out again? And so and sometimes the doctors were ahead of us, and so they would want these patients to come back and they wouldn't have their paperwork filled out. So then either it wasn't dated or signed, or we didn't have a witness signature. And so again, well, we call it joint commission. We have joint commission, and they would audit our charts and say, you don't have a date, you don't have it signed. And so we were getting in trouble for that also. So like I said, Access has just really been a game changer for us.
And now we're probably looking at reg at a 2 to 3 minute mark. Prior, you probably would add an additional maybe 2 to 3 minutes, simply because you had to print out the physical face sheet. So now with Access, those 2 to 3 minutes we can kind of eliminate, because we are launching, the face sheet on a pad through our cows or either at, our workstations.
and we're able to submit it, real time, and it's available for anybody to pull off the patient's account.
And I'm going to pick on one of the ED workflows because I think it really highlights workflows and presence. So when one of our registrars, they have mobile carts, they come into the room to register a patient. Many times they're waiting on a doctor, about to see a doctor, and the registration team needs to get in as quickly and efficiently as possible. So that way we're not delaying any type of nursing or provider care. So once they're in, they can go through our registration. Generally takes about 2 to 3 minutes. They don't have to leave to go get paper. They don't have to go looking for a pen, and everything's right there at their fingertips on their cart. They can hand the walk-on pad over to the patient, get their signature, explain any type of HIPAA, any type of what they're signing for, advanced directives right then and there, and then they get to leave.
Before Access, we use paper, paper consents, paper PHI forms, everything was paper. We were ordering new forms on a bi-weekly basis, and we would order boxes of paper, for our consent forms. We would go through, it would be nothing for us to go through a case of paper in 2 weeks' time. And so with Access eForms, of course, we're not using paper. And so it's environmentally friendly. It saves a lot of time. I would say we're probably saving 5 minutes per registration now.
Before we went with Access, I didn't really even think about the cost of the paper and then the time that patients or that our staff were using to scan in paperwork. And then we have the shredder. And then we have scanners that, they have to be fixed or maintained or whatever. And I thought, gosh, we have really cut down on a lot of cost by going with this one product.
It's not about the bottom line. It's about providing an experience for all of our users, whether we be IT or the medical staff here at the hospital, to allow them to be successful in their position. And if I can do that through innovation, through new technologies, and through support of those technologies, that's what I'm going to do. That's where I want to be. And Access eForms was one of those tools to get us on that avenue. We saw the integrations that could happen. Being part of Meditech is, a phenomenal, integration that everyone loves. I know that Meditech themselves uses Access eForms for their forms. So that was a big, kind of like, oh, well, if this is the company that they're using for their own forms, that should speak volumes to the kind of product that they want to have and we want to have on our campus.